22-year-old woman presented to hospital with multiple episodes of fainting. She reported possible triggers being emotional stress or getting frightened. This wasn't necessarily regarded as anything of concern. Young women faint frequently and high emotion is often a cause. She had a heart tracing performed which was reported as abnormal, so she had a 1-week cardiac monitor fitted. On a lazy Sunday afternoon, she was relaxing at home, reading a book and enjoying some peace and quiet. 2 days later, police broke down her front door and found her dead. Interrogating her heart monitor revealed that she had suffered a cardiac arrest at 4:04 p.m. on Sunday. Seconds earlier, she'd received a phone call from her mother. The shrill ringtone of her mobile phone not only disturbed the quiet of her house, but led to her death. She suffered from an inherited heart condition called long QT syndrome. It's rare, we don't know exactly how rare, somewhere between 1 in 2,000 to 1 in 7,000 people are affected, but it's estimated that it's responsible for 3,500 deaths in the USA per year. The long QT refers to a part of the ECG or heart tracing. The longer it is, the higher your risk of a dangerous heart rhythm. A long QT represents abnormal electrical repolarization of the heart. There are many types of long QT syndrome associated with numerous genetic mutations. With treatment, prognosis is very good. Without treatment, 50% will be dead within 15 years of diagnosis. Long QT syndrome was probably first reported in 1856 in Leipzig, Germany, when a young schoolgirl dropped down dead after being shouted at by her teacher. And when her parents were informed, they reported that her brother had died sometime earlier after receiving a terrible fright. Each subtype has its own characteristics. For example, type 1 long QT syndrome tends to cause problems when patients exercise, whereas type 3 long QT syndrome kills patients in their sleep. Type 2 long QT syndrome causes cardiac arrest in response to sudden auditory stimuli, leading to multiple case reports of patients dying after hearing the doorbell, an alarm clock, or a ringing telephone.